I don't know why it's not working. Okay.
Use the arrow on the
Yeah,
bottom.
okay, okay. I think we agree in saying that reproductive cryopreservation has experimented a huge and a significant increase in numbers, in improvements, in results, and probably is because we have implemented vitrification techniques in the majority of the IVF laboratories. As you can see in these figures, there is a high proportion of IRT techniques that has been applied in either in the States or in Europe that relay actually in the use of vitrified material, cryopreserved oocytes or embryos. And here you can see a list of possible clinical situations and may also explain part of the figures that I have shown in the previous slide. There is situations where you need to freeze all the embryos to increase your outcome. Now, reproductive cell, and especially oocytes, as you may remember, were extremely sensible to cryo-injury. And there were some issues related with this sensibility to cryopreservation. As you may remember, there was an issue related with lower surface volume rate, issues related with membrane permeability or disposition of the cytoskeleton or the spindle cell cycle. So when vitrification came into play, all these barriers that made oocytes and embryo more vulnerable to cryopreservation was actually solved. And we have very good survival rates. And as you can see here, as many of you may have seen these reports, Alpha Consensus and Vienna Consensus reporting the cryopreservation key performance indicator show that we should expect benchmark values ranging between 80 and 99%. So we should expect values of 80% mostly in oocytes and zygotes, and more than 80% for cleavage stage embryos and blastocysts. But still, even we have very high survival rates using vitrification, there are some embryos, some specimens that do not survive. And we have actually identified what are the factors that may affect these survival rates. So some of the most important ones will be maternal age and also poor embryo quality. But also there are other, let's say, external factors that may affect survival rates of our specimens. Low cooling and warming rates. Everyone knows that if we don't pay attention to the cooling and warming rates, we decrease the survival rates. Inadequate handling and storage conditions is another factor. Also, sometimes we need to repeat cycles of warming and vitrification or do biopsy twice to the embryos because we don't have results at the PGT. So those factors we know for sure that will affect negatively to the survival rates. On the other hand, the factors that you see on the right-hand side of the slide are the factors that may not affect or may have a little effect on the survival rates. So we know that embryos can be vitrified at any stage of development. I put in question mark hatching blastocysts because maybe those ones are more tricky and they have more problems to survive. But we know already that the oocyte dysmorphism doesn't affect oocyte survival rate. The biopsy per se does not affect the possibility of embryos to survive, neither the type of RNA stimulation that we use, time of storage, induction of blastocyst collapse. So there are many factors that we know affect and do not affect the survival rate of our specimens. And last but not least, I will bring to attention to the safety of cryopreservation because we were happy using vitrified oocytes and embryos in our cycles, but knowing that we still require more, let's say, studies, large-scale population studies to look to the long-term consequences, so far we can say that perhaps oocyte vitrification does not affect the obstetric and perinatal outcomes, but maybe we cannot say the same to when we transfer vitrified blastocysts, because the transfer of vitrified blastocysts has been associated with risk of women having placenta accreta, preeclampsia, hypertension, and also a higher risk of having babies with large 4 gestational age syndrome. So I leave this slide, I leave this this situation, a question mark open for you to think about it, because I think it's something that we should not forget. So I try to be very brief, as I promised, and this is it. Thank you very much for listening.